MCHC. How can we use MCHC to help us in the diagnosis?
What? Like there's a rule or something?
Mean corpuscular hemoglobin concentration tells us about what percentage of red blood cells are made up of hemoglobin. In many circumstances, when hemoglobin production is decreased, the production of red blood cells also will be decreased. However, in other conditions, hemoglobin production may be decreased, while red blood cells production is increased. MCHC helps to differentiate between these two kinds of problems easily. Gastrointestinal bleeding is an example where both hemoglobin and red blood cells decrease in a similar fashion, due to loss of blood. However, in iron deficiency, we find that hemoglobin is decreased, while red blood cells are less affected. In this case, MCHC would be lower than when there is blood loss. So, how can we use MCHC to help us in the diagnosis? MCHC value can be known from looking into the investigation of complete blood count. Or we can use the violation of the 3-to-1 rule.
That's the rule.
The rule is that hemoglobin to hematocrit ratio is normally 3-to-1. In other words, the hemoglobin is 1/3 of the hematocrit. This rule applies only if the MCHC is normal. And so any violation of this rule means that the MCHC is not normal.
Give me a for instance.
For example, if the patient's hemoglobin is 15, we should expect the hematocrit to be 45, this is the normal condition. But if hematocrit is 35, this means that the ratio is greater than 3-to-1. In other words, hemoglobin is greater than 1/3 of the hematocrit. This means that the patient has hyperchromia. Another example, if we have a patient whose hemoglobin is 12 and his hematocrit is 45, this means that ratio is less than 3-to-1. In other words, his hemoglobin is less than 1/3 of the hematocrit. This means that this patient has hypochromia.
See?
After knowing that your patient has hyper or hypochromia, you can then navigate through the differential diagnosis of each problem. Causes of low MCHC. 1. Iron deficiency. If you have iron deficiency, hemoglobin production will be reduced for each given red blood cell. 2. Anemia of chronic disease. Infections cause inflammation, and less production of hemoglobin. 3. Thalassemia. Thalassemia causes abnormal hemoglobin production. People with alpha and beta thalassemia have reduced MCHC than normal individuals. 4. Sideroblastic anemia. A rare genetic disease which can decrease MCHC. Causes of high MCHC. 1. Hemolytic anemia. This is because red blood cells are decreasing, while hemoglobin is unchanged. 2. Vitamin B12 and folate deficiency. Vitamin B12 and folate deficiency can increase MCHC, because this deficiency impairs the production of red blood cells but has no effect on hemoglobin. 3. Hereditary spherocytosis. Hereditary spherocytosis is a genetic disease in which red blood cells are destroyed and MCHC increases. So, I hope you found this useful. Thank you for watching, and I hope to see you soon.
Okay, thank you very much.